Hello everyone. Am I audible and visible as well? I hope so. I am. So,
Yes, ma'am.
hello, ma'am. How are you all? How's everything going for you all?
Going good.
That's great to hear. So, hi, my name is Prerna. I'm a trauma informed psychologist and I have completed my master's in clinical psychology along with a certification in trauma informed therapy. And I'm also pursuing a PG diploma in guidance and counseling. So today I will be taking the session on the basics of trauma. So we will be covering only the basics today, what is trauma, how it impacts, types of trauma, the neurobiology of trauma, and we will not be going much deeper into the trauma informed techniques. So today, we'll be just discussing, on what's your understanding of trauma. So, before we begin the session, I would just like to have, a base, okay, what do you guys know about trauma? Have you heard about trauma anywhere from Instagram, LinkedIn, or any other social website that you use? If anyone, you can unmute or, you can type it in the chat of what do you understand by trauma? What is trauma actually? Till then, I will just sharing my screen. Yeah. So I wouldn't be able to see the answers if you have dropped them in the chat. Is my screen visible?
It's a painful experience from unexpected happening.
Okay. Yeah, that's somewhat there, on what is trauma. Others, if you can just unmute yourself. So, if we have to talk about what is trauma, so trauma is not actually about the event or the about the situation itself. It's more about how we respond to that situation. So, for example, if anybody had a breakup or they had a fight with their partner or with their friend, so that doesn't mean the situation in itself is traumatic for them, but how they respond to that situation is what can term as traumatic. So, for example, if I have been in a fight, and for me it might not be traumatic because I would have the coping mechanisms to deal with it. I would know how to navigate through that situation. But for someone who isn't able to deal with the situation and it leaves a lasting impact on them, that's how situation might be traumatic for them. So if you have heard about Gabor Mate, who is physician who talks a lot about trauma, so he also mentioned that trauma is not about the situation, but trauma is more about how we respond to that situation. So traumatic experiences can vary widely from natural disasters to accidents to abuse and to violence. So, a situation can be traumatic to anyone depending if they're not able to cope up with that situation, if it overwhelms them to the point that they feel that the situation is out of hand, and it also leaves a very lasting impact on, all aspects of their life. So this is how you can, define trauma in the very basic sense. So another, some examples of trauma can be, experiencing or observing physical violence or abuse, childhood neglect, having a family member who have had a mental health or a substance use disorder, or witnessing violence. So trauma can be anything and everything. And also in trauma, we also talk about vicarious trauma, which is basically not being in that situation, but hearing about some situation which might leave an impact on you. So for you to be traumatized, it's not important that you are in that situation, but you can also be left traumatized if you have heard about a very distressing situation. So, if you're working with clients who might have a history of trauma, of abuse, of neglect, so how can you identify if a situation was traumatic? Because, like now everything is so accessible. So, the pop psychology, how, we have termed everything as a narcissist, how we have turned everyone as a narcissist, everyone is traumatized, everyone is a red flag. So this is how pop psychology has generalized everything a lot. But when you're working with the client, so you might need to know if that situation was actually traumatic for them, or was it a perceived trauma in the sense that they felt it was traumatic, and they might have heard, or they might have a cognitive bias, so that's why they labeled it as traumatic. So this is a triad which you can apply for clients to see if the situation was actually traumatic. So the first factor that has to be there is that it was unexpected. For examples, when accidents are there, so it is almost a traumatic experience for anyone who has been in that accident. So it should be unexpected, something that the individual was not prepared for. The next is the sense of helplessness. Now, this is very important if we see in the situation of a traumatic case, as they experience helplessness in the sense that they can't do anything about it. For example, if we talk about a case of childhood abuse, first it was about unexpected, as no child would expect that their parents might abuse them. Then the next would be helplessness, because they can't actually do anything. They are dependent on their parents for everything, for their basic needs, for their emotional needs. So they feel a sense of loss of control over the situation. Then the next is it shakes a life given, which means when we expect something, when we have a life given, in the sense we expect okay, if there's a parent, they are there to provide protection or nurture us. But when something out of the way happens, it shakes as a expected outcome of an event. So this is a triad that you can, try to see and try to fit into a client story. And if all these three factors are there, then situation might be traumatic. To actually see how it has impacted, how the trauma has impacted them, would vary on how deeper you go into their case. So this is a triad that you can follow. So the three factors that should be there for you to assess if the situation was traumatic or not. First is it should be unexpected. Next, it should be helplessness. And third, it should shook the life given. Now, when we talk about trauma, so there are different types of trauma. So the first is acute trauma, which is basically it's a single isolated incident. So acute trauma can be something which happened very spontaneously, and it only happened once. For example, acute trauma can be accidents, they can be natural disasters. So that will come into the sphere of acute trauma. Then next we talk about is chronic trauma, which actually refers to repeated and prolonged exposure to traumatic events. Now, chronic trauma is mostly seen when we talk about traumatic cases, for example, childhood abuse, sexual abuse, then we say domestic violence. So, these are the things that the individual is constantly exposed to. They're constantly exposed to that same traumatic situation again and again, and that leaves a more lasting impact. Then chronic trauma is also a part of complex trauma. This type of trauma is mostly arises out of rupture between the child and the caregiver. So now as we go into, as the studies and the research are more into the sphere of trauma, there is more nuanced approach towards trauma. So we have also discovered that there is a complex trauma and there is also complex PTSD. So complex trauma and CPTSD are the same thing, but it is mostly when there is, in the case of a child and a caregiver. So these are the three types of major trauma you can say which we see as therapists in our clients. Does anyone have any questions till now? If not, then I will be moving forward. So, if somebody has read DSM or has a background in clinical psychology or even counseling psychology, so they might be familiar with the disorder of PTSD, which is post stress traumatic disorder. So, in that we see that PTSD was first observed in the war veterans when they returned from war, so they had very common symptoms of, flashbacks, of hypervigilance. And in the starting, it was, spoken by the name of hysteria, shell shock, gross stress reaction. But after, more research was done, so it was named as PTSD. So in PTSD, it is one of the clinical manifestations of trauma which we see. It comes into the broad category of stress related disorder, PTSD, acute stress syndrome. These all come under the broad category of stress disorders. So when we see up and until the most recent edition of DSM, PTSD was categorized as an anxiety disorder. But in the new edition, DSM-5, it has been changed because now we have seen that anxiety, the manifestation of anxiety is very different from other anxiety disorders, which might be OCD, generalized anxiety disorder, separation anxiety disorder. So, apart from that, now we are also moving in the sphere of discussing complex PTSD, which is also known as complex trauma. Now, when we talk about CPTSD, it is not mentioned in DSM, but it is mentioned in ICD, which was made by WHO. So, when we talk about CPTSD, it has a very different manifestation from PTSD. So, if anyone wants to go more into the sphere, of how a CPTSD looks like, so they can always refer to the ICD 11, which is published in 2018. You can easily get that onto from internet, or even I could send the complex trauma one, what is the diagnosis. So I would not be discussing the diagnosis of CPTSD because that is mostly done by clinical psychologists, as they are the one who deals with clinical disorders. Now, when we talk about trauma, so trauma does not only have an impact on psychological or emotional health, it also has an impact on the neurobiological changes that we experience. So, through when the research was done, so through fMRI, through MRI, through other PET scans and everything, these changes were actually observed in patients of trauma or trauma survivors. So, when we talk about trauma and how it impacts on neurobiology, there are three main categories or three main components which have a structural change. So the first one is hippocampus, which is the memory storing system. So what happens is when somebody goes through a traumatic event, so mostly it is observed that people have memory gaps, that they can't remember what happened to them. They have a very blurry timeline of how things went with them, and this is because the hippocampus has stopped working in that space. They're not able to remember what have happened in them. And after a prolonged trauma exposure, it has also been observed that there is a reduce in the volume of the hippocampus, which is involved in memory and learning. The next one, amygdala, is the most important when we talk about trauma, because when amygdala in itself helps us detect threat. So it is a threat detection center. And when somebody goes through a traumatic incident, it becomes overactive. So if you have seen movies in which PTSD is discussed, so you would have seen, that they're always scanning for threats in their environment. They're always hyper vigilant. They even when they hear a and whenever they hear a car horn also, they become very alert. That is because the amygdala has gone into an overdrive, and it's the fear center, so everything around us feel a lot unsafe when amygdala is heightened. And the next is the prefrontal cortex, which helps us in making rational decisions, decision making powers, executive functions. So when what happens, so we have a fear circuitry, that is a normal threat detection circuitry of our body that helps us protect us against traumatic incidents or against threats. So the fear circuitry helps that first the amygdala senses, if there is a threat in the environment and how should we deal with it. Then amygdala sends signals to the prefrontal cortex, which helps in making a decision: should we fight, should we flight, should we freeze, or we should fall. So these are the four trauma responses that we will be talking about in the further slides. So when we talk about fear circuitry, so what happens that this whole fear circuitry gets into an overdrive when somebody has faced a trauma incident. So when somebody experiences a traumatic event or experiences extreme fear, brain chemistry is altered and the brain begins to function differently. And this is called the fear circuitry, which in itself is a protective mechanism that we all have. But when somebody experiences a traumatic event or experiences extreme fear, this fear circuitry may kick in, and the prefrontal cortex, which makes all the decisions, begins to function less. So, this means that in the midst of trauma, a person might not be able to think through the situation and make decisions such as calling from help. So it is not a matter of choice. The brain has gone into a survival mode and the fear circuitry has bypassed the prefrontal cortex. So when somebody is in danger, their prefrontal cortex shuts down and it stops working. And due to this, their memories are encoded differently. So that where hippocampus comes in. So the brain does not encode memories in a chronological order. So that's why many people who have been through traumatic experiences don't remember what happened to them, where they went, what happened, what was the time, what was the situation, what was the environment there. And then there are gaps in the memory. And whatever the fear circuitry in the brain focus attention on during the assault is most likely to be encoded into the memory than periphery details, which means that when the amygdala is there, it is only focused on the threat and it's not focused on the other factors that might influence that situation. So this is why the hippocampus only remembers what happened in that moment, but not what led to that moment, what were the other factors that they were in the moment, and what happened after. So survivors also experience dissociation when something traumatic happens with them, which is also a survival reflex in itself, where somebody feels disconnected from their body and they go into an autopilot mode. So what does autopilot mode means? So in autopilot mode, a person is not using their prefrontal cortex to make decisions, but they rely upon the habitual modes. They rely on the habits or the automatic reactions they have. And these automatic reactions or habitual responses are mostly rooted in socialization. For example, women are more socialized or women are taught how to be polite and pleasing to save themselves. So, for example, if you have seen a case of women who have gone through a sexual assault, so the most experiences that you will hear from them is that they froze. They don't know what to do, or they were not able to do even if they wanted to do. They just froze because that is what is taught to us, that if something bad happens with you as a woman, the best you can do is just let it happen and you just froze in that moment. So this is how the whole fear circuitry works and how our neurobiological changes happen. Now, when we also talk about, then there are also neurochemical changes that happen with us, in which there the cortisol levels are always increased in trauma survivors. Then there's also a difference in the levels of neurotransmitters like serotonin, dopamine, which affect mood and pleasure and reward pathways. So now, when we are talking about trauma, so we also talk about what are the uh, different responses of trauma. So these are known as the four F's of trauma. So the four F's are is the fight response, the flight response, the freeze response, and the fawn response. So trauma is not, as we discussed, trauma is not just defined by the event, but also how we as an individual react to it. And these responses can be different for everyone, and there is no right or wrong way to respond to a traumatic event. So when we talk about the fight response, we have heard, when people are in a situation, so they either fight with that situation or they just run away from the situation. So the fight response, this creates a readiness in us to confront and combat a threat directly. In the flight response, we want to escape from the situation or avoid the situation. Then we talk about freeze response. It is a state of immobility or paralysis. So as we were talking, so uh, kindly mute yourself. Yeah. So, yeah, as we're talking about the freeze response, so in this, as we were talking about, how women freeze when they're being sexually assaulted. So, this is what happens that they don't know how to, fight or run away. So, the best way is to just let that happen, and it is a form of de-escalation, and in most cases free response is also seen as dissociation, which means getting out of their body psychologically. And the next we talk about is fawn response, which comes in the form of people pleasing. So, when we talk about, so in this, we seeks approval of the perpetrator so that they don't hurt us more. For example, if we take of a situation of child abuse, if a child is being abused constantly, so the child might actually try to people please their parent or the perpetrator so that they are not abused more, and they only work according to the perpetrator so that they can avoid what is happening to them. And in this, we prioritize others' needs of survival more than us. So these are the four types of trauma responses. And for that, I also have a case study. So, you can read this case study and, you can let me know what kind of a trauma response this would be. We can take 5 minutes for the same.
Recording in progress.
Um,
Yes.
Fawn response.
Okay. Others? If others have any, is it fight, flight, freeze, spawn?
Ma'am, fawn response.
Okay. Yes, so this is a fond response because we can see that in the presenting concerns, we have people pleasing, which is a key word when we see. So, in this, we can see that she had a very highly critical mother and an emotionally unpredictable father. So, any assertion of her needs was met with guilt or withdrawal. So, this she never confronted anyone. And every time somebody told her, you do this, even though she had no recognition support, she always said yes. So, yes, people who said fond response, this is the correct. Now, this is another case study.
Ma'am, phrase is from
Okay, others. Okay, one side flight response, flight.
Flight response.
Okay, anybody can give me a reason why this would be flight?
As in in the flight response, the key component is avoidance,
Okay,
and we can see here the keyword is mostly how he avoids, and he feels that this is the easiest way to do so. So maybe that's why flight response.
okay, can it be freeze or fawn?
I think for freeze, it's more of a shutting down things, na. So I don't
Mm-hmm.
think it's just my opinion. I don't know if I'm right or wrong, ma'am.
Mm-hmm.
And I have no idea about the fawn response.
Okay. So so mostly when we are talking about traumatic cases, so there is no, one right answer. कि, okay, this only comes into the category of freeze or flight. But in this, it can be a mix of both because if we see in the presenting concerns, there is an internal shutdown, which mostly is a dominating characteristic of a freeze response. Because if we see that if everyone's okay, I am okay, so he is emotionally disconnecting from the situation. Mostly, flight responses would be complete avoidance of that situation, that I don't want to be there. But in this, there is a mix of if we see that if everyone's okay, I'm okay, it can both be a freeze and it also can be a flight. Now it depends. If we have more information about how it presents, then we might have been able to get more deep into it. But it can be a combination of both. It cannot be fight because fight would involve confrontation, direct confrontation. And when we talk about fond response, it's mostly in the sense of people pleasing, that he would want not to get into the situation by agreeing to whatever the terms of the perpetrator are. So that is what is most fond response about. Now, now there's another thing which affects how a person has gone through a traumatic situation is the attachment style. So, do you know about the four types of attachment style and what are those? If anybody could unmute or even type it in the chat. What are the four types of? It's not PTSD or CPTSD at this moment because these are both clinical disorders. So, this is just from a counseling perspective when we're dealing with clients. So, PTSD and CPTSD is a more deeper approach towards trauma, so that you would have to read on your own. You can always refer to DSM or ICD for understanding PTSD and CPTSD. And I will also send some resources that you can refer to. Okay, somebody has written secure, anxious, avoidant, and unorganized, disorganized. So, somebody can tell me what are the characteristics of the four attachment styles? Like, how do they show up in relationships?
Ma'am, can I try?
Sure.
So for secure attachment style, it's more of a person is very confident in their relationships and they know their self-worth, they know their dignity, they know their morals and rules and they go by them maybe. And they, if a help is needed, they invite supporters and they also accept the help from the outside. And they're not like कि मुझे किसी की मदद नहीं चाहिए or something like that. They just actually accept the help. When it comes to anxious, people are very clingy, they
Hmm.
are highly emotional
Hmm.
and they cannot hear a no from you, maybe.
Hmm.
And it maybe it can be presented as a red flag also in the relationships, what people talk about. And it's just people seek reassurance. That's the major keyword here. That seeking reassurance is their go-to thing to do. And when it comes to avoidant, it's mostly of how distant a person is from the relationship, from the situation, from the circumstances that they're present in. And mostly they avoid closeness,
Mm-hmm.
as we can see in this case, according to my opinion. And disorganized, it's maybe they're just disorganized and they just don't know what to do at the moment. So they maybe like, mess the things around and maybe unpredictable behavior is there.
Hmm. So yeah, it was mostly correct. So for disorganized, you can understand it as mix of anxious and avoidant. So it's more of a push and a pull response that they would push somebody away, but the moment they feel that the person might need them, they would start pulling that person towards themselves. So it's more of a push and pull. So this was almost correct. So, when we talk about attachment theories, so we all know, from the experiments of Bowlby and, the monkey experiment and all, we know that, we have that need to form the close emotional bonds with others, especially when we are toddlers, when we are infants, and when these attachment styles are not secure in the parent child relationship, it will affect the client's intimate relation and also how that client would interact with you as a counselor in the session. So, there is potential for us as counselors to misdiagnose or terminate a counseling with the client if we do not understand their attachment and if we do not know their developmental history. Thus, we as counselors need to, know, we need to have a good understanding of what these attachment styles are and how they will affect, your relationship with the client. So for example, if a client has an anxious attachment style, so when they would be with you in the sessions, so you would observe a lot of people pleasing happening. So you know that you as a therapist are able to provide empathy to them. You as a therapist are there for them. They would be, like message you out of therapy hours. So you need to understand these things that they have an anxious attachment style. Now mostly conversations with the clients are not encouraged outside the therapy, apart from the professional therapy space that you have. And you might consider terminating the client or telling them this is not encouraged. But then it can also have a potential impact of you rupturing your therapeutic alliance with that client. And mostly this attachment injury occurs when one partner violates the expectation that the other will offer comfort and caring in times of danger and distress. So there can be an attachment injury that you can do to that client if you're not aware of their attachment style and how it is being manifested in your own counseling relationship with them. So how, what can be the impact of childhood trauma? Because mostly our attachment styles are formed in our childhood and they're carried into our adulthood and the further ages. So, trauma, abuse, and neglect can hinder the formation of healthy attachment patterns. And clients with developmental trauma like childhood abuse, sexual abuse, violence can develop insecure attachment styles. And when you if you're dealing with clients and whenever you will deal with clients, you will see that there's a repetition of the similar patterns that they have with their parents, with their partners. So when we talk about how the attachment styles have an impact on the therapeutic relation, we can see that they might regress to the earlier developmental stages during therapy. For examples, presenting childlike or immature behaviors and perspective when they're triggered by the attachment wounds. So some people might get very defensive over a little thing because that has triggered their attachment wound, or they might return to a cognitive state where certain developmental tasks remain unmastered. We if we see this from a psychoanalysis point of view, so clients who have more of a sensory stimulation that they need, so this might be triggered. So this is how attachment styles have an impact on therapeutic relationship. So what can you do as a counselor when you see that a person have had a history of trauma and they have an insecure attachment pattern? So what can you do as a counselor? So as a counselor, you have to approach them and align them with their regressed, with their uh, later developmental stages. Then you should also have a consistent and reliable relationship with them to heal them from their attachment wounds. And due to attachment wounds, they would of course have some misguided notions about themselves, about the relationship, about the interpersonal security. And then also you would have to tailor your approach in a way that aligns with them in which state they are. You cannot rush or force them to think from a mature perspective, to think from a rational perspective, because they've regressed to a later stage. So, this is what I had for today with the basis of trauma that we covered. If anybody has some questions, they can drop in the chat box or they can unmute themselves.
Yeah, ma'am, I have a question.
Yes.
So, as you were saying, there are the stages, or there are the things that is different in PTSD and CPTSD.
Mm-hmm.
And also like CPAD, PTSD or the CPTSD is more deeper or a more broader thing. So how can we differentiate the current stage of the trauma or this or the trauma that the person is facing? Is a normal trauma or a PTSD, CPTSD?
Okay. So, PTSD and CPTSD have proper classifications that are given in the DSM and the ICD criteria. And when we're talking about traumatic situations, so it is not compulsory that like every trauma will get converted into a PTSD or a CPTSD state, because everyone have their different coping mechanisms, everyone has their different attachment styles, their own support and their own social networks. So you as a counselor would have to see that, mostly, like, I'm a counseling psychologist, so the clients I see, they do not have the symptoms of flashbacks. They are in a freezing or a flight state, but they are not hypervigilant. It has not impacted their daily functioning to the sense that they cannot functional in an outside world. So if I talk about my own cases, so the cases that I've dealt with who have had a trauma, yes, it has impacted their sense of self, their sense of security, their sense of security in their body, but they are still able to function outside in the world. They're able to go to their jobs. And when we're talking about PTSD, it's a lot different scenario. So, if you have gone through the DSM, you will be able to differentiate that trauma informed therapy is actually needed everywhere. It is not only limited for people who have gone through a traumatic history. It is more of approach which has compassion and more empathy and a more understanding of how systemic issues also affect us. So, and if you're talking about PTSD and CPTSD, again, they are two different things. I would say CPTSD is a step above PTSD because it has a complex manifestation of that. And I'm not trained in either PTSD or CPTSD. So I would suggest that you go through the DSM and ICD ones, and then if you have any questions, I can always refer to you to. I can of course refer you to Mrs. Archika. So she's a senior psychologist, so she might be able to explain you a little bit much better than I can.
Okay. My question is very much to my first question is
Mm-hmm.
I read somewhere like PTSD is more of a kind of the trauma that has happened in the childhood, and if the person is going through complex trauma or the CPTSD,
Mm-hmm.
uh, that is a I mean uh, that any new event that has happened in their life and was coming from that PTSD. I mean the new phase of the trauma. Um, and PTSD converts into the CPTSD.
Yes, we can say that depends again. And truthfully, I'm not trained into clinical disorders that much that would be able to offer you a much better differentiation, unfortunately.
Thank you.
Yeah. Thank you. Thank you, Kushi. Anybody has other questions? If not, then we can end the session. Thank you everyone for being such an active participant and interacting with me. I will be also doing another workshop soon on interpersonal therapy. So I will see you then. Have a good day. Have a great week. Bye. Take care. Thank you. Yes, I can share the PPT with you all. Bye.
Thank you, ma'am.
Thank you.
Thank you, ma'am.